Welcome to the Learning Lab. My name is Roman Garcia. The subject matter for today from this video is I'm going to introduce to the public the formula that we use to simplify what we are trying to do when we are trying to correct bowing or knocking of the knee. What we discovered working with patients through these years is that we had to come up with a simplified description or illustration so patients can follow the protocol easier. So what we developed was a mathematical formula to do just that. Because what we discovered is that to correct bowing or knocking on the knee takes tremendous amounts of information that the patient needs to understand. And sometimes that information is too overwhelming for the patient to follow. It's just too many bits of information that the individual has to process. So what we did is that we created a mathematical formula in order to simplify the process itself. In a little while, I'm going to show you how we can use this formula on a particular case to try to predict an outcome of a patient's rehabilitation. But before I do that, what I want to do is I want to show you the formula itself. It's very simple, and I think this pretty much captures the objective and the biology behind what we are attempting to do when we work with our patients to correct their bowing or their knock knee. And it's a formula that our clients or our patients are able to follow so they can maintain consistency in the protocol itself because they understand what they're trying to do at the biological level. And the formula, it took years to develop it, but it's very simple. And those are usually the best formulas, mathematical formulas, that really depict a reality which is not very easy to perceive. And this is the formula itself. As we go on with the videos, I'll describe each variable and what each variable entails. But the formula is this. Prep. That means prepping. Prepping plus manipulation plus time equals adaptation. That's what the formula is. And this is the key word right here, is the result of this formula. When you add these variables together, you end up with adaptation. Prepping plus manipulation plus time equals adaptation. Now, what I'm going to do is in a little while, I'm going to show you exactly what these variables mean in this case that I'm going to show you. The actual physical manifestations of these variables I'm going to demonstrate to you in a patient that we saw not too long ago. And you'll see what adaptation is. But before we do that, again, I just want to introduce to the folks out there my assistant, Ana, and I'm going to let her have a few words.
Hola, mi nombre es Ana, es un placer compartir los videos con ustedes y me encantaría que vieran los videos para así ustedes aprenden a mejorar su salud. Muchas gracias.
As always, I always appreciate Ana's help. She helps me immensely to get the message across or the information across. So her participation in these videos, to me, are greatly appreciated. But before we get back to her, I'm going to come over here so I can show you the actual prepping, manipulation, time equals adaptation. So you can see what exactly this formula is all about. Now, this is a case that we saw not too long ago. This is a female patient. She came to me after suffering a serious injury while she was playing out in the beach. She put her foot in a hole, the knee twisted, the classic twisting and rotation, with a vector force going across the knee, which she basically suffered tremendous amounts of pain and she was concerned. So she came to me and I examined her. And the knee, obviously, when I examined the knee, it was positive for ACL deficiency. Now, she went on and she did an MRI, and indeed it did show that her ACL was torn. Now, this patient went against my recommendation, which was to continue with treating the knee as my protocol required, so she can get regeneration of the ACL ligament. There was still some strands of ACL in that knee. It wasn't completely unstable, but fear set in, and she went to her ortho, and her ortho talked her into having the ACL reconstruction. In a little while I'm going to show you the post-ACL reconstruction. But before that, the reason I'm showing you her video, her x-rays, is because I want to show you the prepping manipulation time equals adaptation. This is her pre-ACL reconstructed knee. And if any of you folks out there have seen all our videos, you get an idea what all these lines and symbols mean. I'm not going to go into what these triangles means, but I'm going to just point out the important lines that are within the context of the formula. Now, this is her right knee, this is her left knee. This was the knee that was involved. This was her normal knee. Now, when we did the x-rays and we did the measurements, what we saw was that the involved knee was in a knock-knee posture. It was in a knock-knee posture. Her uninvolved knee was relatively neutral. It had a little bit of knocking in it, but it was relatively a neutral knee. Now, post-injury, the involved knee, when we did these magnitude values here, we saw that the way that her knee was, she was putting greater stress on the inside part of the knee. This is the inside, this is the outside. This is the uninvolved. You see that it's the opposite. This is the inside, this is the outside. The triangle on the outside, you see that it's larger than the triangle on the inside. This means that in her normal untraumatized state, she normally puts more weight on the outside of her knee than she does on the inside. Post-trauma, and I assume it's post-trauma, it could have been pre-trauma too, but post-trauma, the weight-bearing load on the right knee is asymmetrical. She's putting more weight on the inside than the outside. And her right knee is definitely more knocking than her left knee is. Now, this is the state that existed post-injury. Now, she went on and she had an ACL reconstruction. And now this is the picture post-ACL reconstruction. This is the right knee. This is the right knee. I'm going to put her right knee, her uninvolved right knee, next to her involved. This is involved and this is involved. This is before the ACL reconstruction. This is after the ACL reconstruction. Now, what the ACL reconstruction did was it manipulated the weight-bearing loads. That's what it did. It manipulated. Now, this is post-ACL reconstruction. She already has the ACL reconstruction in this knee. When they put that ACL reconstruction inside that knee, and they tightened that knee, look what happened. Now she's weight-bearing more on the outside than she is on the inside. This is before the ACL reconstruction. You can see the triangle larger on the inside than it is on the outside. Now, after the surgery, she has more weight-bearing load on the outside than she does on the inside. So the ACL reconstruction created a manipulative effect. Now, the problem with this ACL reconstruction that she's going to have in the future is that because the ACL was placed in a pattern which is not anatomically correct, she's going to go on living and experiencing tremendous amounts of load on the outside part of her knee. You can see the tunnels right here. This is the tunnel. This is the tunnel on the tibia, which is fine. This is at a good angle. And then this is the tunnel on the femur. This is the problem. This is the tunnel. This is where it's located. It is at 12 o'clock. That is a problem. Now look at the interesting thing about this post-ACL reconstruction. The ACL was not placed in the proper anatomical alignment. And even though they tightened this knee is still in a knock-knee pattern. It did not correct the knocking, which I found it very interesting. Now, why didn't it correct the knocking? You see the weight-bearing vector right here. This is the line right here. This knee is still in a knock-knee pattern. You would have thought that after they stabilized that knee and the surgeon tightened that knee, that it would have corrected this knocking, but it didn't. The question is, why didn't it? And the reason is because of the result of the formula, the prepping, manipulation, time the knee adapts. Before she tore this ACL, if it was torn during that trauma, this knee was already involved. This ACL was already involved. The knee had adapted to something this patient was doing. Now, if you went into her history, she did a lot of these new age type of boot camp type of maneuver exercising, very aggressive exercising. For some reason, her right knee adapted. She was prepping the tissues with the exercises. The tissues were being manipulated by the stress itself. And as she continued and exposed her knee to continual time under that environment, her right knee adapted to being in a knock-knee pattern on the right knee. So my opinion with this knee, she was exposing this knees to prepping, manipulation, and with time, her knee adapted to a knock-knee pattern. So once even though they did the ACL reconstruction, and even though they didn't put it in correctly, which didn't help, maybe if they would have aligned the ACL in its proper anatomical formation, anatomical position, which should be in this direction right here, maybe the surgeon would have been able to correct this knock knee. In a little while, I'm going to show you with my assistant Anna what the proper alignment and how this alignment was on her knees. So basically what we've got here is we've got a pathological state of a knee that was being prepped, manipulated, and with time adapted to a knock-knee pattern. And the ACL reconstruction didn't help any. So what I'm going to do now is I'm going to come over here to Anna and show you. Yeah. Now, the left knee, I drew here basically the ACL orientations of how it should be and how it is on this patient. This is the involved. This diagram right here represents what you just saw on the x-ray. This is how that surgeon engaged the graft, the ACL reconstructed ACL. He placed it. The bottom part was okay, but when he came to the femur, he drilled the tunnel at 12 o'clock. That's why it did not correct the actual knock knee. Because even though he created stability in the knee, the bones had already adapted because of this patient and the environment that this patient exposed this knee to. The bones is what was causing the knock knee because the tissues had adapted. Now, a properly aligned ACL reconstruction, and maybe it would have helped the knock-kneeing of this patient whose x-rays I just showed you. Maybe if the surgeon would have applied the ACL reconstruction in its proper anatomical pattern, which is in this pattern right here, maybe he would have gotten some correction. So basically, this patient whose x-rays I just showed you, her future can be, she may have a future of being exposed to these abnormal weight-bearing patterns where her tissues are going to adapt in a degenerative way. She's going to develop arthritic changes on the outside of that knee because her bones have adapted to an environment that she exposed her knees to. And the ACL reconstruction, all it did was stabilize the knee. It did not create, it is not creating an adaptive environment. It's not prepping, it's not manipulating, and with time, she's going to continue to be exposed to degenerative stresses because she's still operating in a knock-knee pattern. Siéntate ahora. So basically, you can see that no matter what position Ana goes, the joint, the ACL reconstructed joint is still going to exhibit the same type of adaptive weight-bearing loads. It doesn't matter the position she's assumed. This is the proper location of an ACL reconstruction. This is what you just saw. It's very rare that you see surgeons actually accomplish this type of pattern. Don't ask me why surgeons have a hard time creating this pattern, the normal anatomical ACL reconstructed pattern, but they just do. It's very rare. I can count in one hand the times that I've actually seen this type of ACL normal alignment in a reconstructed ACL. So in essence, you can come to me. So in essence, what I just showed you is a pathological case of this formula that we developed that a patient can follow to simplify what they need to do in order to create adaptive changes in their joints. You can use it on joints that you just want to create corrections to, or you can use it in joints that are arthritic, painful, with bowing or knocking. It really doesn't matter. The human tissue will adapt if you provide the proper environment for it. But you need those three critical variables. You need to prep the tissue so the tissues can adapt easier. You need to create manipulation. The only way you can do that is by using a specialized brace, the one that I've shown before. And you need time. You need time in order to create those changes. Basically, time, all time represents is the unity of information that an individual will be able to consistently use through a consistent pattern, consistent use, consistently doing the same thing over and over again. That's pretty much what time means, is utilizing the data, the knowledge that we give you over the course of your life. And the result is adaptation. And that's basically, you follow this formula and you can adapt bowing or knocking of any knee. But you have to follow the formula, and we simplified it as much as possible. Again, for anybody who has any questions on the videos that we produce, please feel free. Just send me a message. There's always contact information on the videos, or you can just make a comment on the video. Again, for anybody that's watching this video, from Ana and me, we want to thank you. Until next time.